So I just like, let me just sleep for the night, and then if it's still painful, or like if it seems like it's a fracture, I'll go to hospital the next morning.
That just takes you, and that you start the work without doing an assessment, taking a history. It's just the same
process.
And the pain is over, they just discharge themselves, which is not right, because pain is one aspect of it, but there's other things that maybe I saw, maybe muscle imbalance and other things that we need to correct.
He does a lot of physio for pregnant ladies who are preparing for labor and delivery, and he mentioned that it's actually good for them to help loosen their muscles and just relax their pelvis. Hey guys, welcome back to A Dose of Health, the podcast where I give you not too much, not too little, but just enough information to help you make an informed decision. Today on set, I have a lovely guest. Her name is Ivy Moore here. And I'll just allow her to introduce herself because I think you'll do it better.
Okay,
so over to you.
Thank you.
Don't be shy.
Thank you, sir. Thank you. My name is Ivy, an experienced and licensed physiotherapist.
I like the experienced. That's how you normally introduce yourself.
Yeah.
I like it. Keep it up.
Thank you.
Okay, so Ivy is here today for a very important episode that is dear to my heart because, as you know, I had an injury this year because I thought I was a sportswoman. I will die on the hill that I was a sportswoman, guys, And when I decided that, this is the direction I've chosen, it didn't choose me back. So I injured my foot, and part of the recovery was physiotherapy. So Ivy is here to help us just talk a bit about physiotherapy and the importance of physio, not just for recovery, but also for your well-being and your day-to-day life. Okay, but before that, so I usually take my guests through, it's called A Journey to Inside Out. Have you watched Inside Out, the movie?
No.
I need to start counting the guests who haven't watched Inside Out because muko wengi sasa. So you can go add it to your list. So there's 1 and 2.
Okay.
So it's basically a movie that it talks about emotions and how emotions come to play and why we act the way we do.
Okay.
And I feel like it's such a nice movie for adults, and I enjoyed it. I loved it. So I just want to find out how are you today emotionally? Like now, ukwaje?
Right now, I would say anxious
Oh.
because of the state of the country, obviously.
Yes.
And basically that. Because of the state of the country, because you don't know how it's going to be in the afternoon. Also in the future, like next week, we don't know how it's going to be.
Yeah. Actually, that's like a very good emotion to touch on. I think for us, these June babies, and then I'm all July, but it's like early July. So it's such a rough place to be, because it's like now for the past 2 years, it's the same situation. But I think that anxious state is something that I also relate to. And like we're just wondering, when will it get better, but hopefully it does get better. And this is also a moment where we just want to send our condolences to the parents who have lost their kids, and also just well wishes to those who've been injured, and hopefully they recover well. For me, the emotion I have is, I don't know. Do I have an emotion? I don't know. I feel like today, for real, I'm just there. Like, I don't know if I have an emotion. I'm just there. But I think it's also just because of that uncertainty. You don't know what is going to be in the afternoon tomorrow. So I think I'm just there and just looking to see like how it unfolds. Then also they've passed the finance bill. So where? KRA might have our data soon. Like, there are just so many things that are happening in this country, and you don't know, where to be. But we thank God that we are alive, that we're in good health, and that we're able to seize the day. Because I know that's not the reality for everyone.
True.
Okay, now moving on. Medical jargon.
Okay.
Is there something you want to debunk? Maybe a term that you use in physiotherapy, or a medical term that you feel that people are either misusing or don't understand, or you just want to elaborate it more for people?
Let me think through it.
Okay. I think for me, mine will just be physiotherapy.
Physiotherapy,
you can debunk that for us.
So physiotherapy, let me just say the aim. The aim of physiotherapy is to relieve pain and restore function. I think there's no any other way I would explain it, but just say
Relieve pain and
relieve
restore
pain
function.
and restore function.
Okay, okay, sawa. And just the way you explained it, there's a big important point that I'd like you to elaborate on when it comes to physiotherapy, just because of the pain aspect. So maybe as we start off the episode, I have a few questions just to gauge you kidogo.
Okay.
In relation to physiotherapy. Okay. So the first question would be, do you judge people's posture in public? Like, do you just find yourself randomly judging?
For sure. I do that so many times. I would be walking, and then when I see somebody walking in a certain way, I try to understand what's wrong with that person, like muscular wise, like joint wise. I try to understand what condition do they have, what weakness do they have, and all that. Also, in maybe public setup where you're seated, you can find yourself judging, like, wow, that person is actually having a really bad posture.
Let me just sit up because...
Yeah, so that's very common.
Yeah.
Your mind just goes to the posture so often. Sorry.
Yeah. I think it's similar for us as doctors. Like sometimes if you have a physical manifestation of a condition and you don't even know the person, like let's say they've just walked into the room, sometimes you find yourself trying to diagnose the person
even before they speak.
Even before they speak. It could be a random man just walking on the street where you're just like, the way his legs are positioned, or that lesion on their head. So it's something common that even us we do. But you try as much not to vocalize it unless you have been invited to that conversation. Okay, another question. So, and we're discussing this earlier with the production crew.
Okay.
When it comes to mattresses, hard versus soft, which one is best?
Hard.
Hard?
Yeah.
Why?
Hard. Okay, when you have a soft mattress, what happens is maybe it sinks in.
Yeah.
And then when parts of your body are sinking in, then it interferes with the alignment. First of all, let's speak about maybe the correct posture, sleeping posture.
Yeah.
You're not supposed to sleep on your back or your tummy. You're supposed to side lie.
I'm trying to think how I sleep. Now I'm a side sleeper. Okay.
You're a side sleeper.
Yes.
Yeah. So if you're a side sleeper, then when you have a soft when you're side sleeper, when you have a soft mattress, and then maybe your hips are sinking in, and then some parts are sinking in, and the other parts are not sinking in, it interferes with the alignment, and it might give you back pain later on.
Okay.
Yeah.
Now me, I love a soft mattress. Like honestly, I just can't
soft
do that.
To what point? Does it sink in? Does it?
Not completely, but like just a bit. Like just a bit. Yeah. I love a soft mattress, and I feel like that's the hill I've decided I will die on. But I understand like orthopedic mattresses are hard for a reason, and it's what you're talking about, the alignment. But also you've said hips are sinking in. It says God didn't bless me like that, so
no, it doesn't have to be like big hips or anything. Just your hips might just sink in.
Sawa. And what about pillows? Hard versus soft?
I wouldn't say hard or soft. I would say memory foam. Memory foam is more ideal compared to hard or soft, because when you have a hard pillow, then your head posture will be raised, and then it will stress the neck muscles. And when you have soft pillow, then your head will sink in, and maybe you might use your hand to support the head, which will later on give you so many problems with the nerves and all that. So the best pillow is memory foam.
Memory foam.
Because it balances the alignment of the head and the rest of the spine. Yeah.
And the memory, what does it remember?
The memory foam.
Yeah. I'm assuming the memory, it remembers something.
It doesn't... Does it remember anything? No.
We'll
but
check.
It's... It just maintains the alignment. It doesn't, it's not too hard, it's not too soft. It just has the perfect balance.
Okay. So memory foam. So for your pillow, and I'm assuming also your mattress, like there's also memory foam. I've seen when I took my friend shopping for mattresses, and there was memory foam, there was different levels of hardness of a mattress. And they recommended now the memory foam.
Memory foam, yeah. I think both memory foam pillow and mattress would be the ideal.
Okay. Yeah. What about sleeping on the floor?
No, that's not recommended at all.
Yeah.
Because in as much as I'm saying hard mattress is okay, now the floor is extremely hard. And sleeping or sitting on hard surfaces can lead to some compression of the nerve and also lead to a lot of tension build up on the muscles.
Okay. And I know sometimes this can be a bit insensitive when considered, because there are people who I didn't choose to sleep on the floor.
True.
So we acknowledge that. But if you're able to, what she's saying is it's very important for you to pick your mattress and your pillow, wisely, so that it maintains your alignment.
Yeah.
Okay.
Also the padding, the
padding.
When you have a mattress, the pressure points, when you're sleeping on the side, there are pressure points that are on the surface. So when you're lying on a extremely hard surface like a floor, those pressure points on the hips and all that will be like compressed too much.
Okay. Understood. Next question before we now get into the episode. Okay. Is there physiotherapy versus massage? What's the difference?
Okay, I would say massage is just for relaxation, for you to just maybe feel good and relax. But physiotherapy is more complex. You have to do an assessment. You just don't do it. It has to be, it's kind of medical.
Yeah.
Not kind of, it's actually medical. It's more complex in the way that you have to do an assessment, you have to come up with a diagnosis, you have to have a treatment plan. It might involve massage in the layman's language, but in our own language, you say myofascial release.
Myofascial release.
Yeah.
Okay. We'll put, maybe that can be also another
myofascial. Our to debunk.
Yeah, our to debunk. Yeah.
Okay. Yeah, so it's about just relieving the pain, as I said, and correcting the malfunction.
Yeah.
And restoring function.
Okay. Yeah. So in your practice, have you found that there are people who are going for massages and they need physiotherapy?
For sure, so many.
Yeah.
So many, because maybe they don't know where to, like, they don't understand when do I need physio and when do I need massage. So when you just feel you want to have a good time, you can go for a massage. But when you actually have pain or preventative in a way that maybe your work involves a lot of sitting and you want to try to find out how will I prevent a future back pain? How will I prevent so many other things?
Yeah.
You go for physiotherapy.
Okay. Yeah. So I can go for physio even if I don't have any malfunction or anything. I'm trying to restore function.
Yeah.
Okay.
But to prevent it in the future.
Okay. So I think we've jumped the gun, but let's just take a step back. How does one become a physiotherapist in Kenya?
In Kenya?
Yeah.
So in Kenya, definitely after Form 4, you either decide to do a degree or a diploma.
Okay.
For diploma, you go either to KMTC. I only know KMTC, obviously.
Okay.
For degree, you join either JKUAT or Moi University. And then in university, you have to learn, the first 2 years, you learn anatomy, physiology, pathology.
It's quite medical.
It's quite medical.
Yeah, because we do the same thing.
So you have to know the background of human body. You have to know the diseases that can affect the body. And now you also have to know a little bit about pharmacology. So you have to understand the medicine aspects, mostly the painkillers, not the other ones.
Yeah.
And then
do you
from
find
there,
that people are overdoing pain medication?
For sure. Actually, that's a real issue. I think when you have pain, the first thing people do, you take a painkiller even before going to the hospital to find out what the issue is.
Yeah.
And then after you've taken the medication for way too long and the pain is not going away, that's when people normally go to the hospital. And then maybe you're prescribed more painkillers instead of being directed to physiotherapy.
Okay.
That's also another problem,
Yeah.
I think. The best thing is after you maybe see a general doctor, now the general doctor is supposed to direct you to physiotherapy.
Yeah.
And now we take up from that. We do an assessment because there's always an underlying thing.
Yeah.
You just don't get pain out of.
I think it's a running theme this season for A Dose of Health. My camera, it's a running theme because even we had an episode with pharmacists and they said the exact same thing.
Okay.
Yeah.
You have to know the underlying issue.
Yes, you have to know the underlying issue. In fact, one of the pharmacists said that a hangover and a brain tumor both present with a headache.
Wow.
So you might think you're cheating one thing, but
Yeah,
it's something
exactly,
else.
exactly.
Okay,
Yeah.
okay. So we've talked about school. Did you always want to become a physiotherapist, or like when did your journey? How did your journey start?
Yeah, I think not always, like since I was so small.
Yeah.
I began to think about it after Form 4.
Mm-hmm.
Yeah, that's when I decided, I think I'd like to know. It was out of curiosity, actually. I wanted to know what's physiotherapy, how is it? Yeah.
Have you ever been injured before where you needed physiotherapy?
Yeah.
Okay.
So many times.
So, what are the qualities of a good physiotherapist, and how do I find a good physiotherapist? Let me give a backstory. So, as I mentioned, I injured my foot. So, I was playing netball. And I know people are just like, netball is a sport where you're not moving. Yes, I know it's a sport where you're not moving. So, how do you get injured? Guys, let me tell you, it's the movement and then the stopping, the abrupt stopping that actually can injure you. But basically, what happened for me is I jumped and then someone pushed me mid-air. Then I landed badly.
Oh, sorry.
Yeah. So thank you. I was in denial for the longest time. So I got home and then I was telling, in fact, before I got home, I called my mom. I was just like, I've hurt my foot. I'm coming home. Please come downstairs and help me. So when I just got home, I was just like, yeah, this needs hospital immediately. But Mimi Nani, denial. So I was just like, let me just sleep for the night. And then if it's still painful or like if it seems like it's a fracture, I'll go to hospital the next morning. Yeah. At midnight, I called my sister. I was like, we are going in the morning. This is definitely a fracture. But anyway, the recovery period now, after I had the cast removed, I had a brace. So now starting physiotherapy.
It was tough.
Luckily, of course, the hospital had the orthopedic and the physio departments were in the same like building, so it was easy to find a physiotherapist. But the timing, now scheduling was a bit problematic. So I was just like, how do I get another physiotherapist, and especially one who's not in a hospital, because it can be a bit intimidating to have to go to the hospital to just do physio. Yeah. So, but I found some good ones, but it wasn't very easy. I had to ask around a bit. So how do I look for a good physiotherapist, and what are some of the good qualities in one?
Okay.
Yeah.
So when you, apart from the hospital,
Yeah.
at home?
Both. Yeah.
Okay. Where to find? Definitely in a hospital. That's you
Number
can
one.
find. Yeah. Because at least that one you're sure that they are licensed.
Yeah. Oh, there's licensing involved.
Yeah, there's licensing.
Okay.
Okay, let me start with the qualities. They have to be licensed by Kenya, the Physiotherapy Council of Kenya, PCK.
Okay.
And yeah, they have to have experience. Apart from that, there's supposed to be an assessment. Anybody that just takes you and they start the work without doing an assessment, taking a history, it's just the same process.
Okay.
You take history, you do an assessment. They have to explain what are you suffering from, what's the issue.
Yeah.
They have to give you a treatment plan.
Okay.
Yeah. They try and discuss with you, explain to you, this is what we're going to do, this is what you have, this is what we're going to do, and the aim is this and this and this.
Okay.
To at least make you understand.
Yeah.
I think.
Yeah, because you have to understand, and I think it's also important to understand like the end goal, like what are we working towards.
Exactly. You just don't like start doing your own thing without the patient understanding what's going on.
Yeah.
And also for them to know the expectations to have during the session.
Okay.
Another way to find, you can also find a physiotherapy online. But now, I don't know how you'll confirm if they're licensed and experienced. I think that
you just do your due diligence.
Yeah, you just do your due
do you guys have like a number, like a license number?
Yes,
and a portal?
Yeah.
Okay, then I guess that's how, because now like for us what we do is we have KMPDC has a portal where if you take my license number, you can go and confirm that I'm a registered and licensed doctor.
Okay.
Yeah, so is it the same for you guys?
Okay, I'm not sure about the portal, but for sure you need to have a registration number.
Okay. So
yeah.
All right. So now question. You've mentioned that we can do physiotherapy for our everyday lives, for injuries. For injuries, what is usually the goal? Because like for me, when I was doing physiotherapy, when my pain was done, I felt like, see, that's it. So when do you stop? When do you start? When do you continue physiotherapy? And especially the stopping part. When do you stop physiotherapy?
Okay, just as I've said earlier, there's the bit of an assessment and the treatment plan.
Yeah.
And normally you're told maybe you'll need 5 or 10 sessions for you to recover. Then every day, I don't know if everybody does this, but I do this. Every day you have to reassess your patient in terms of functionality, the pain. There's normally a pain scale. You ask your patient from 0 to 10, how much is your pain right now? So you go reassessing the patient until you come to a conclusion that the function-wise, let's say the range of movement of the joint is okay, they're pain-free, and now you've achieved all the goals that you had set for the session, then for the recovery, and then if all that is met, that's when you stop.
Okay.
But most patients normally, when the pain is over,
just talk to me directly.
and the pain is over, they just discharge themselves,
Yeah.
which is not right, because pain is one aspect of it, but there's other things that maybe I saw, maybe muscle imbalance and other things that we need to correct. So you have to stick to the end so that we also achieve the rest of the goal that we had set for the recovery.
Okay. Okay. I think for me, the functionalities are very important point, because sometimes you think that, okay, I think I'm back to 100, and then you just do like a small movement, you're like, I can't even do that movement.
Exactly.
I actually need to just continue. But also, what I learned is that physiotherapists are able to equip you with exercises to do on your own.
Yes.
So you also have to take the initiative. Like, you have to keep, doing, however small or minimal value you feel like it's adding. It makes all the difference.
Actually, let me talk about that. So most patients, you tell them these are your home programs. Maybe you're supposed to do these stretches and these exercises, but they don't do it. And then some of the education you gave, like you're supposed to correct your posture, maybe ergonomic wise. This is how you do some body mechanics, and then maybe that patient didn't do exactly what you told them, or didn't even bother doing anything, correcting anything. But they come back and then they tell you, I'm still in pain. I'm wondering, what's wrong? When will this pain end? But when you actually dig deep, you find out the patient actually didn't do their part. And actually, for physiotherapy to work, you have to correct the cause. For example, for back pain, if the posture is the one that resulted to the back pain,
posture, I'm just going to have to keep sitting up.
If it's the posture that caused all this, then if you don't correct the posture, you'll still end up
with back pain.
You'll still end up with back pain. If you don't correct the thing that you are told not to do, if you do the thing you're told not to do, you'll still end up in the same pain. So most people normally get relief and they end up back to the same habits, and then you start saying, physiotherapy doesn't work. But physiotherapy didn't work for you because you didn't follow the instructions. You didn't do the exercises. You didn't correct the posture. So
that's true.
It's actually on your end.
So you say it's on us.
Yeah.
It's on us.
Yeah.
Okay, now that you've talked about posture, let's talk about posture a bit. And pains. Let me not say back pain, let me just talk about joint pains. So I don't know if this is something you've observed, but I observed it. More and more we're seeing younger people complaining of joint pains. So knee pain, ankle pain, back pain. And I know posture has a lot to do with it, but also just ergonomics. So your chair, are you sitting for long hours? Are you standing? How are you standing? How are you sitting? What can you say about that?
So normally, actually, most people with pains nowadays are more the middle age more than the old age.
Okay.
Reason as to why it's because of the change in lifestyle.
Yeah.
Because normally nowadays we sit for long hours.
Yeah.
Most people. And then after work, you drive home probably. You're seated the whole time.
Yeah.
During your
weekends,
during your weekends, you don't have an active life. Maybe you sleep all day or you sit and watch a movie. And so your active life is almost to zero. And the problem with maybe prolonged sitting or prolonged anything. Okay, life is a balance. If you do either of too much sitting or too much standing or too much bending, you will still have a problem. So you have to find a balance. If your work involves too much sitting, you have to do like an active exercise that reverses that. Because when you sit too much, there's an imbalance that happens. Your back muscles, they get tensed.
They tighten.
And the other muscles that get weak, like the glute muscles, they get weak over time. So, and the muscles the hip flexors, they get tight and short. So when you have that kind of an imbalance, you have to do exercises that now reverse. They either strengthen the glute muscles and they stretch the tightened, tensed muscles and strengthen the back muscles. If you stand a lot, you need to, standing is better than sitting, actually.
So I've heard. But let me tell you, there's one thing I hate in this world is standing. Oh my God, I hate standing so much. And that was one of the things that made me not do surgery. Because the standing, those will stand for long hours. And I noticed, especially if you don't have a good shoe, which I think we'll talk about, your back, your lower back really suffers. So I know standing is good, but the same thing, balance.
It has to be a balance. But you rather have standing, you rather have problems with standing than sitting, because sitting, it really gets to the nerve so quickly.
So what would you tell someone who has a job where they have to sit for long hours? Like, what can they do in between their day?
So in between your day, if you're able to take a break after every 2 hours, the best. When you get at home, now I can't demonstrate the exercises, but you have to do certain exercises.
Let's talk about the break. We just say take a break. What are they doing during the break?
You stand. You do any activity that involves standing or walking around for like 10, 15 minutes or 30. That is the best.
That is, your boss is just looking at you like, excuse me, company time?
Or else you can invest in a transitional desk where you can spend time sitting, and then when your time for standing is up, you just elevate the table and then you continue with your work while standing.
But what I usually tell people is, in fact, I started doing this thing on my Instagram, but I've taken a break where at 10, because usually at 10 I go and have like a cup of tea or coffee. So I'm usually like, guys, it's time to stand, exercise, move your joints, move your muscles, just so that you can have a break from the long sitting. But also at the same time, it's good for your eyes. Because especially if you've been looking at a screen the whole time, you also need to exercise your eyes, So stand up, leave your desk for maybe like 10 minutes, walk around, go outside, get some vitamin D, because vitamin D is so good for you, and then come back and continue.
So you just get a rest holistically.
I love that. And now for I remember talking about so I really enjoyed my physio, and I used to have like conversations with him just randomly, because I was trying to confuse myself and distract myself from the pain, because the pain is there. And he mentioned that he does a lot of physio for pregnant ladies who are preparing for labor and delivery. And he mentioned that it's actually good for them to help loosen their muscles and just relax their pelvis so that it eases the labor and delivery process. So I want us to talk a bit about that, and maybe what are some of the insights that moms can learn from yourself, a physiotherapist, around that area.
So I'll start by mentioning some of the changes that happens during pregnancy.
I'm taking notes.
There's postural changes. Since your tummy is expanding, and then the curve of the back is now being exaggerated, and it tucks on the vertebral bodies. Your
spinal bones.
Spinal bones. Your spinal bones get a lot of compression with that exaggerated curve. And also your back muscles, they strain to some extent. Your actually, do you know abdominal muscles play a part in supporting the back? So when they're like kind of stretched out, they tend to get weak during the pregnancy period. So when they're weak, they're also not playing their part of supporting your back. So that's why most people, not most, some experience back pain during pregnancy. Also, the other change is you have a lot of pressure on your pelvic muscles because of the weight of the baby. And because of that pressure, you might now experience some pain
and
discomfort. Also, there is hormonal changes. The ligaments are laxed now, so some joints are
a bit, let's use the term looser.
They're a bit looser. So you might experience some, I wouldn't say back, but at the tip of your back, the last part.
Like upper chini.
Upper quad, SI joint. That's where most people get the pain because of that laxity. So when you have that, actually strengthening exercises will be better than just stretching. And what else?
What's
mostly
an example of like a strengthening exercise?
Strengthening exercise. Strengthening the glutes. How do I explain?
Like squatting, Amma? Not for a pregnant lady.
Not for a pregnant lady. Just squeezing in your glutes and releasing. That would be really effective. Actually, that's what we advise.
But you can do that when you're seated.
Yeah, you can do that when you're seated. Or
Okay.
lying down on the side.
So
those are the changes that happen when you're pregnant. And so in that situation, we relieve the pain, maybe through hot packs, myofascial release, and some pain. In a situation where I've assessed and noticed it's more of weakness, then we do more of strengthening exercises. And
so
and also trying to like educate the mom, the mom to be on proper ergonomics. Like right now, you're not able to like lift things in a certain way, certain weights, and how to sit, how to do this.
Okay. And when would be a good time for them to start? Let's say they're having back pain, like when is the best time to start that physiotherapy? And also, when would they stop?
Okay. So a good time to start is as early as possible.
Oh, okay.
Okay, yeah. As early as possible, because it's not only when you have pain, you can start to prevent it in the future. Like, for example, we know in the future, I mean the couple months to come, you'll have maybe some...
Because of the growing belly?
Okay. You'll have some back pain, so we do some strengthening of the core muscles, the strengthening of just simple exercises. It's not going to be like really tough. Strengthening of the core muscles, strengthening of the back, the pelvic muscles. Also, you can decide to start when you actually have pain. Yes. And then we relieve the pain, we educate you on what to do, what not to do, strengthen the muscles again, and when to stop when you don't have pain, and okay, when you're just discharged. Like we've achieved the goal. And then now you're discharged. And that's it.
And postpartum, maybe especially for ladies who have gone through C-section. I know many of them, not many, but I've had some complain about back pain. So can they also do physiotherapy? Of course, when after it's been cleared by their doctor that they can start light exercise. Is physiotherapy something that they can venture into? Or?
Yes, very, 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 very important. As I've said, when your belly is expanding, your abdominal muscles are getting weak. So when you just go back to work and continue with your life without doing physiotherapy, you might easily get back pain after that. So many patients actually after pregnancy, after CS, postpartum in short, they normally complain of back pain and they assume it's maybe the spinal injection. I don't know. You'll tell us more about that. And for me, I associate it with the weak abdominal muscles and the weak pelvic muscles and the weak abdominal muscles.
I would say that spinal has been known, not known, but it's one of the common complaints we've seen after spinal injection, which is the injection you get when you're having a C-section to anesthetize the lower half of your body. Some of them complain of back pain after, but also it can also be related to now the things that you're talking about. Yeah, so it might not be an isolated case. It might be an isolated case where it's the spinal strictly, but also, the changes in pregnancy also contribute to now the back pain. Yeah. I've also seen some ladies complaining of sciatica. So sciatica is basically when there's a nerve being compressed in your lower back. And of course, the growing baby and, the increase in girth can be an attribute of that because of the pressure.
Yeah. So for CS, after the CS, you're supposed to start some strengthening exercises for the abdominal muscles.
Okay.
It can start by just you squeezing in your abdominal muscles and releasing.
Okay. I was trying to say, can you do that?
And then we build up from there as you recover.
So actually, question, do physiotherapists see postpartum patients in the hospital? Like, you see when the doctors are doing the rounds, is it something that you commonly do, or it's only when a patient comes complaining of maybe something that's related to physiotherapy?
Okay. Normally, in a public hospital, yes,
Okay.
it's there.
Okay.
In private, I don't know.
You're not so sure?
I'm not so sure.
Okay.
In an outpatient facility, people come only when they have now problems.
Yeah. Okay. I think
But it should be.
Yeah.
It should be like that.
Yeah.
Where after delivery, you start physiotherapy immediately to strengthen back the muscles and to strengthen the core muscles so that you don't have back pain in the future.
Yeah. And when you say immediately, it's after your doctor has cleared you for that movement. And now, before we're almost reaching the end, kids
actually, even after CS, it's actually really immediately. Because you need to be taught how to move.
Yeah. Oh, yes.
And that's the work of a physiotherapist. You need to train the mother. This is how you get out of bed. This is this is how you walk. You don't walk a certain way. You're not supposed to do this and this. And
you've reminded me something. It's the same for patients who've gone through knee replacements or hip joint replacements or just an injury that's orthopedic. Many a times we feel that physiotherapy is supposed to start when you're not in pain.
Exactly.
But let me tell you, the saddest thing is you have to start immediately after the surgery, like the next day. And to me, that has always been ridiculous. But then I got to understand that as your muscles and your joints are healing, they can heal in the wrong position.
Exactly.
If you don't start as early as possible. Okay, that makes sense. Now, what about the kids?
The kids.
Yeah, pediatrics. Is there pediatric physiotherapy?
Yeah, for children who have cerebral palsy.
Oh, yes. Yeah.
And also in cases of
injuries,
fracture,
of course. Yeah. Okay. And for children who are born with maybe let me explain how cerebral palsy comes about. So normally, in a prolonged or a difficult labor, sometimes the child has restricted oxygen supply, and we call that birth asphyxia. So birth asphyxia can actually lead to now the child developing cerebral palsy after, just because of the reduced supply of oxygen to their brain. So there are areas of their brain that were starved of oxygen, and then they develop cerebral palsy. So many of the times they need that not rehabilitation, but we call it occupational therapy. And it's not just the physiotherapists. They need speech. They need just to be able to function in their day-to-day life, and physiotherapy is a big aspect of that. So how does that work for kids? And I know it's taxing emotionally because it's so sad seeing a child with cerebral palsy, but it's also different grades. So how does physiotherapy come into play here?
So physiotherapy come into play by, it's like muscle re-education. Like you're trying to activate the nerve also through the exercises. And also trying to, if they have stiffness, you're trying to reduce the stiffness, restore the range of motion within the muscle. But most part is about just activating the nerves, through exercises, through modalities like TENS.
What's TENS?
TENS, it's a machine that is used to, you can use it to relieve pain, to activate the muscles, or the nerves.
It's the electric thingy that you put. Okay. When I was doing my treatment, that was like the best part of it. It felt so nice. Yes, it awakens the muscle.
Yes.
Okay. Yeah, and children with cerebral palsy have stiffening. And I think the same for the elderly, especially if they've had like things like a stroke, or if someone is not as mobile as they were before. So that immobility can actually lead to stiffness of the muscles and the joints. And physiotherapy plays a very important part there.
Very important part to relieve the pain, to restore functions. Yeah.
So you work closely with caregivers as well?
Yeah. True.
Okay, yes. Okay. Now, let's just go back to a few questions. I know we've touched on a lot. We've covered a lot. But now I want you to have fun, kidogo. Okay. So give me one myth about physiotherapy that you want to debunk.
Okay. One myth, one common myth is physiotherapy is for the old.
The old and injured.
The old and injured. Physiotherapy is not for the old.
Only?
Yeah. It's not for the old only. Because, okay, let's say most young people assume that, let's go to the back pain.
Yeah.
Assume that when you have back pain only when you're old.
Yeah.
But actually, you don't have back pain only when you're old. You can actually have an 8-year-old with back pain.
An
nowadays.
8-year-old?
Yeah.
Oh, that's very young.
That's very young. I think the lifestyle.
Yeah,
like
lifestyle.
Nowadays, we are more of internet people.
Yeah, we are less active.
Yes. Even the kids. Like we used to have PEs and all that, but
and we used to look forward to playing outside. Like in the morning, you're just like, oh my gosh, it's 8. You shower quickly, you go outside and play, and then you don't want to come back in the evening when you're being called. At home, come inside. I don't want to come.
So nowadays, children are more on their phones, their tablets, the TV, so they're less active. So it's very common for you to get a child with. It's not common actually. It's rare, but
you've seen cases.
Yeah, I've seen cases like that.
So the camera is yours. What are you telling parents today in relation to their children?
Please just allow your child to go outside. Minimize screen time as possible. Your child needs to be active for them to actually have strong muscles. Strong
joints.
Strong muscles and strong joints.
Why are you going to say proprioception? Big words. Then another thing is a big bust can affect my posture and cause back pain. True or false?
True.
Tell us a little bit about that.
When you have a big
bust
when you have a big bust, you tend to like your shoulder curves in, and then that makes your upper back muscle strain a lot because already there's an imbalance. So when your upper back muscles are struggling, your chest muscles become tight and short with time.
Okay.
So you kind of have that imbalance, which leads to now upper back pain.
Yeah.
So the best way to do that is do an exercise that strengthens the upper back muscles. And also when you're finding a bra, you find a bra that is holding your bust in position properly, like they're not
a firm
support, so that you don't have that in curve of the shoulders.
And it's good that also these days, so having an extremely big bust, we call that gigantomastia, and there's treatment for that as well. Like if you feel like it's affecting your posture and your quality of life, because back pain can actually affect your quality of life, you can have a breast reduction. So at least they have avenues these days. Another question, when it comes to shoes, what are the best everyday shoes to wear?
I would say sport shoes.
Okay.
Yeah. Okay. Sport shoes, proper sport shoes. You see the athletes, the kind of sport shoes athletes have. That's really nice because your feet is not like straight. Your foot is shaped in a certain curve. And when you wear something that is not supporting the curve, it strains the fascia, a certain thing called fascia on the feet.
So we can just say the supportive structure.
Yeah, the supportive structure. And now when it's strained, you now start having pain on the heel. But when you when you wear a sport shoes, it supports the calf properly, especially if you walk a lot. For people who sit a lot, I don't think it really matters as much.
Yeah, as much.
Yeah, but for people who stand a lot or walk a lot, it's important.
Yeah. And I think that's also why these days we see a lot of doctors wearing sneakers with their scrubs or Crocs. But Crocs, and I wouldn't say initially when Crocs came out, they weren't good for standing, but they started making orthopedic Crocs, especially for the medical field, which we appreciate. But yeah, the sport shoes. And something else that I learned last year is apart from just supporting the arc, even your ankle joint as well. Because like for me, as I mentioned, the poor support from the shoe. I used to wear flat shoes to a ward round that's like 5 hours flats. Hey, until I learned my lesson. Because now at the end of the day, you have back pain. Yeah. And then also my posture is not the best. So it was just a recipe for disaster. So guys, your shoes are very important. Yeah. Okay. Then last one. Before now I give you your parting shot.
Okay.
If physiotherapy could have a tagline, what would it be?
Pain relief and
and restoration of function.
Yeah.
That's a good one. Okay. Now I think we've covered a lot, but I just want to find out, as Ivy, what would you like to see incorporated into physiotherapy? Maybe like in the next 5 years? Yeah.
Okay.
5 to 10. Let's be realistic.
5 to 10 years. Okay, I'd like to see, first of all, in the medical industry, I'd like to see more general doctors referring patients to physiotherapy when necessary. In those cases that you see this patient has muscular issues, joint issues, you just refer them to physiotherapy. I think there's a slight gap in the medical sector where the general doctors prefer giving pain medication and muscle relaxants over physiotherapy.
Okay.
And now I think that's the major.
That's the major
That's
one.
the major.
Maybe if you don't mind me asking, how closely do you work with orthopedic surgeons?
Oh, that's also a thing. I think orthopedic surgeons, immediately after surgery, they refer. Or before, actually, you can do physiotherapy to prevent surgery.
Yes. Yeah.
So orthopedics, they either, for example, they tell you first do physiotherapy, and then when it doesn't resolve, we can proceed on with
surgery.
Yeah.
So you guys work very close together.
Very close together.
Okay. Okay. Well, I've asked that is because, like, for me, what I would do is if I have a patient who I feel needs physiotherapy, I would also recommend them to go see an orthopedic surgeon.
Oh,
yeah,
okay.
just so that, because I know at some point you will work together. The orthopedic surgeon will either recommend physio, or even if I take you to the physiotherapist will recommend an orthopedic surgeon. Yeah, so I used to refer upwards. But we hear you. We hear you now. We'll incorporate physiotherapy as well, instead of just, solely relying on pain medication.
Yeah.
Okay, sawa. Sasa ya kufunga, what's your dose of health for the day?
My dose of health for the day is don't suffer in pain.
Oh, good.
See a physiotherapist. Yeah.
Okay. What is my dose of health for the day? Do I have one? Oh, I think we were having this conversation earlier. My dose of health for the day, and I think this will be a recurring theme, is sleep. Please prioritize your sleep. We're talking about how I struggle to sleep early. And of course, it's the phone, it's the laptop. But yeah, prioritize your sleep. And if you have to get rid of the phone, get rid of the laptop. I had someone saying that you sleep with your phone in the kitchen. Please just do it. Yeah, because your sleep is very important.
Yeah, true.
Yeah. So that's my dose of health. Thank you so much, Ivy, for coming. I think I've learned a lot. And for me, I actually would like to make physiotherapy more of a wellness thing, where I'm not just using it to heal an injury, just to improve my day-to-day life. And especially because I noticed I have bad posture. So that's something I'm really trying to work on. It's either I'm slouching or I'm lying down. So I really need to work on my posture. Now, do you want guys to find you?
Yes.
Okay, plug yourself.
Okay, you can find me on Instagram through, my account is called Ivy the Physio.
Oh, yeah. Okay. We'll put it here.
Yeah.
So you talk about things related to physio?
Yes, but the actual account for where I post the physiotherapy content is
You forgot it. It's okay. Remember.
I'll remember.
Yeah.
Or can I just check?
Yeah, you can check. So as you're checking, guys, please remember, like, share, comment, subscribe, and please follow. And if you haven't tried physiotherapy and you are in pain or you feel like you need to give it a try just to improve your quality of life, please do so. It's very beneficial. And have you found it?
Yes.
Okay, fine. You can plug it.
It's Theocare_physiotherapy.
Theocare_physiotherapy.
Yes.
Okay, so I will put it there. For me, my name is Dr. Hope Simiu. This is my handle. And then also follow us on A Dose of Health, the Instagram page, the TikTok page, YouTube, Spotify, Izozote, all of them. Please follow us there. So Ivy, thank you so much for coming.
Welcome. Thank you for having me.
Oh, you're welcome. And that's a wrap.